Good morning, everyone, and thank you for attending our webinar today. Our webinar today is Dissemination for HIV Prevention Interventions, How to Share Your Project Story at a Conference and Make an Impact. I'm here as part of the Center for the Evaluation of HIV Prevention Programs in Chicago, or the Evaluation Center, which is a collaboration between the Institute for Sexual and Gender Minority Health and Wellbeing at Northwestern, the Center for Prevention Implementation Methodology at Northwestern, and the AIDS Foundation of Chicago, and we're supported by the Chicago Department of Public Health. Just for a brief overview of what we do at the Evaluation Center, we oversee the evaluation efforts of 20 HIV prevention demonstration projects in Chicago, and this constitutes 15 sites throughout the city that we've been working with over the last year and a half. Just a little setup for what this webinar is about. We're holding this webinar to focus on staff who are new to dissemination or wanted to refresh their knowledge about what it is to disseminate research. We know that planning and implementing HIV prevention programs may be difficult and often lose little opportunity for people to engage in dissemination activities, but dissemination is a very important part of any research project. Our hope is that you will be able to leave this webinar with a little bit of an opportunity to, or an ability to submit a conference abstract, know about attending conferences, and figure out how to disseminate all the good resources and research that you've been doing at your organization. Just to give you an overview of who will be presenting today, I'm Gregory Phillips. I'm the Research Assistant Professor and Director of the Evaluation Data Integration Technical Assistance Program at Northwestern. I'm just giving the introduction. Our main speakers today will be Amy Johnson, who's the Director of Research, Evaluation, and Data Services at AIDS Foundation of Chicago. We have Eric Glenn, who's the Executive Director of the Chicago Black Gay Men's Caucus. Julia Dudek, who's the Program Manager for the Institute for Sexual and Gender Minority Health and Wellbeing at Northwestern, and Christian Adalmes, who's the Research Assistant at the Institute. Some general housekeeping items. Just on this slide, so all attendees are in listen-only mode. You can submit any questions you want at any time during the call through the chat feature. We'll be taking all of our questions at the end of the session, so we will reserve time at the end to ask any other questions you have. You won't be able to submit any questions over the phone as there are too many attendees for this to take place. And we have a few other things. We have polls that will pop up throughout the talk that we will be asking you to answer questions on. Julia will be facilitating those once we get to those points in the webinar. And as I said, we'll be having question and answer at the very end of the webinar. We'll have about 10 minutes left to go through those. Some main learning objectives, just so you have an idea of what you can expect to get out of this webinar by the end. We hope you'll be able to name at least 2 reasons why dissemination is important for public health professionals who are implementing HIV prevention projects in the field. Identify at least 2 qualities of an effective conference abstract, and list 2 best practices when developing a poster presentation for a conference or other research presentation. And now I'll turn it over to Julia, who will start with the 5 W's of dissemination.
Thanks, Gregory. So we're going to start with a little audience. Check all of the following that apply to you. So if you've submitted an abstract to a conference, if you've authored a conference paper, presented a conference, a conference poster, presented a conference poster, given a talk or a workshop at a conference, or none of the above. And if you've done none of the above, that's totally fine too. That's why we're here today with this webinar. So we'll be talking about presenting and posters for those of you who are beginners, as well as those of you who might have a little bit of experience. So I see the results rolling in. It looks like 70% of you have submitted an abstract to a conference, 50% have authored a conference poster and presented a conference poster, 30% have given a talk or a workshop, and 20% are none of the above, or about 18. Looks like a couple answers are still rolling in. But so actually it's gone down. A little less than half of you have presented a conference poster. That's great. So but we'll be definitely giving you some tips about poster presentation. And we'll start first with the definition of dissemination. So dissemination means making information available and usable to various audiences through a variety of channels or formats. A channel is a route of communication such as a news conference or a poster. A format refers to the actual layout for communicating the information, such as both oral or written formats. And you can see that there's many different ways to disseminate information. So at conferences, which we'll focus on today, even within conferences, there's a lot of there's posters, talks, workshops, roundtables, and even having a vendor table or booth can be a good venue for disseminating information. You can use online media such as blogs, podcasts, videos, and e-newsletters to distribute your information, and then print. And of course, everything in print can also be distributed online. So a brief or a report, a white paper, or maybe even a peer-reviewed manuscript in a journal, and program manuals and program materials as well can be distributed in print or online. So whatever method you choose, it depends on a number of factors, such as the audience that you want to reach and the resources that you have available. We're going to focus on one of the most common forms today, which is conferences, and then drill down to a specific type of presentation, the poster presentation. So why do we disseminate at all? So there's an old existential question that a lot of you have probably heard. If a tree falls in a forest and nobody hears it, did it make a sound? Think of that tree as your project, and if no one else hears about it, how will we be able to learn from your work? So dissemination, then, we can think of as an opportunity to be heard, to give a voice to your project, to engage with others in the broader community. It's also a chance to tell your project's story, and we'll return to that metaphor throughout the webinar. A little more concretely, some reasons why dissemination is important. It contributes to public health knowledge in the field of HIV prevention, and then this can also in turn directly or ultimately influence public policy or funding streams, and that includes both local funding, such as through the health department, as well as national funding. It helps to promote your organization and your project, which has an element of marketing involved, and this might ultimately lead to new collaborations or new opportunities and funding. It builds capacity both of your organization and your personal capacity around dissemination. So once you've, let's say, presented a poster once, it becomes much easier in the future. And it also, you can also learn from others and ultimately improve your project. So conferences especially open up a dialogue with other people. And this has a twofold effect of adding your project story to the collective knowledge in the field of HIV prevention and creating opportunities for you to learn from others to improve your project or to future iterations of your project. We have another short poll coming up. So the question is, true or false, dissemination should only be done at the end of a project? It looks like the votes are still rolling in, but so far everyone's gotten it correct, which is awesome. Oh, that's changing a little bit. I spoke too soon. But overall, about 90% of you said false, which in this case is true. So we had put this in here because there really is this misconception sometimes that you have to wait until the very end of your project to disseminate information about it. But while most dissemination, or well, it usually occurs later in the project, there's definitely opportunities to disseminate throughout different phases. So returning to the metaphor of story, there's a story to tell about every phase of your project. And as we'll see on the next slide, it could be the intervention, development, or adaptation phase, and implementation, as well as the analysis phase. So this table outlines those phases, what type of information could be disseminated at each time point, and then where you can find that relevant information. If you're one of the sites working with the Evaluation Center, you'll notice that under Sources or Tools, we've linked a lot of the evaluation tools that you've already been developing with us on this table. So in the beginning, during development or adaptation, you could tell the story of the process that you've undertaken to tailor or adapt the intervention to a different population, or maybe the story of how you developed a homegrown intervention. And the source for that is usually formative data, like formative research, like qualitative data from focus groups. During implementation, you'll be seeking to tell the story of how you achieved your aims, specific project activities or outputs that you undertook, and you can refer back to your logic model for this, and then process evaluation data as well, which again, if you're one of the sites we're working with, can be found in EvalWeb also. And for the analysis or the traditional evaluation phase, you might have access to a lot more outcomes data. So this will be about what you did or didn't accomplish, such as behavioral change or PrEP uptake, changes in knowledge, behavior, or health outcomes. And this also will be found on your logic model and your outcomes measures alignment grid, including all sorts of data like outcomes data and evaluation web data. And what your project didn't accomplish can also be as valuable to know as what it did. So that might be used by yourself or be useful to other people to help build more effective programs in the future. And then there's also overarching narratives that might be unique to your project and conducive to disseminating. So for example, if you've had a successful partnership, let's say with a CBO partnering with a health clinic or a community academic partnership, sometimes there's venues to disseminate that information. In thinking about who you want to disseminate to, audience is very important. So who are you trying to reach with your story? And that's going to influence the venue that you choose or what conference you choose in this case. You might want to disseminate to your colleagues or your peers working in the field of HIV prevention, or maybe a similar or related field like behavioral health, health promotion, harm reduction. You may be interested in disseminating the results back to your community stakeholders, particularly if you're working in a community participatory framework. Of course, policymakers, like we mentioned before, people who set the agenda for funding streams, and then possibly researchers or academics. These are all totally valid. It just depends on your intent. And again, it can influence what conference you choose and also how you frame your abstract, which we'll talk about in a few minutes. So how do you find and how do you choose a conference? We have a few tips for you on this slide. So usually funders will hold conferences, and that's a great starting point, whether it's CDPH or CEC, local or nationally. You can use professional networks and word of mouth from your colleagues for recommendations based on conferences that they've been to in the past. We also recommend subscribing to blogs or e-newsletters of other organizations to stay connected. AIDS.gov is a good starting point. And then tapping into social media can be really fruitful as well. And I'll give the example of Christian, who's sitting next to me here. So Christian recently joined a LinkedIn group about evaluation when he joined the Evaluation Center. And he got connected with the American Evaluation Association through LinkedIn, and then ended up attending the conference recently, a couple weeks ago. You should definitely do your homework. Check websites. You can usually find past agendas online to see if the conference looks relevant to you, and read the criteria for abstract submission, and then check for other clues like the conference theme and what group might be organizing the conference and what their mission is. We've put together a list of conferences of interest for HIV prevention and those working in the field, and it's here on the slide, as well as a handout that we'll be sending out afterwards with all the links. I know some of you may have presented at some of these local conferences in the past, such as the LGBTQ Health Conference that was held October. It'll be in the spring of 2017. Also, next year, the Third Coast CFAR will be having their research symposium, and the UIC Minority Health Conference is another great venue, and then CDPH will be having their HIV conference this fall. At the state level, we wanted to highlight the Illinois HIV STD conference coming up this fall, because poster abstracts are actually due at the end of August. So that's a great opportunity to apply what you're learning on this webinar today. And like I said, we'll provide a handout of all of this after the webinar. So just one, last question. I'm sure, a lot of you are probably thinking about, well, how much does this cost, and do I have a budget for this? So cost is a consideration, and things that you'll want to consider are the conference admission costs. So check for volunteer opportunities or scholarships. Sometimes they're out there. For local conferences, smaller conferences maybe have smaller fees, or sometimes will waive the fees for people who are presenting. So those are other ways to reduce your costs. And then for travel, if you're going out of state, you'll definitely want to budget for, or downstate, you want to budget for a hotel. If you're flying, transportation to or from the airport, obviously airfare, and then a per diem for food and incidentals. And if you're wondering how much that costs, you can check the website that we have up here. It lists all the government rates by location. And then of course your poster, which the cost can vary. If you're printing in advance, your cost will usually be about $50 to $80, depending on the size and the type of finish or specific options that you might have from the printer. And with that, I'm going to turn it over to Amy Johnson, who will be discussing how to write a conference abstract.
Thank you. The conference proposals are called abstracts, so it's going to be a short summary of your work and what you'd like to present at the conference. You want to use it as a means of conveying what was done, why, what was found, and then explaining the implications of your work. And your abstract will then be read by reviewers who score and select the presentations they'd like to have at the conference. When writing the conference abstract, what you want to consider, and I like to do this before I start writing, so you'll find what works for you, but really start thinking about these four main areas. The first one being audience. So consider the organization that's sponsoring or holding the conference, and then who would be attending. So who would be interested in the conference, and then frame your topic in a way that speaks to that audience. So for example, if you were working on a demonstration project, and the abstract that you propose to a conference is primarily targeting community-based organizations, that would be very different from an abstract that you would write targeting clinicians. So for the community-based organizations, you might discuss the process of getting community input and buy-in to the development of your project. But then to a conference that would be more focused for clinicians, you might take a different approach and present medical data. So it's the same project, just different lenses tailored to the audience of the conference. The next thing that you want to think about is the conference theme or area of focus. So you want to look at, does the conference have a particular overarching theme like social justice or minority health, LGBTQ health? And then are you submitting under a particular area or focus or a population of interest? So oftentimes the abstracts have different sections, or the conference has different sections like HIV treatment or healthcare access or specific target populations. So this information should all be listed on the website as well as in the call for proposals. And the information should inform what you include in your abstract. The phase of the project is important. So what stage your project is in, and you want to tailor your abstract to the phase of the project that you're in, and that will be completed before the conference. So you don't want to put in your abstract, your outcomes when you're not going to be completed your project before the conference. You want to know, the next thing you want to consider is the story you have to tell. So why is the work you're doing impactful, and why should it be heard by others? And that should really come across in your abstract. Just a quick one, but your abstract should be these four things as well. So it should be complete, concise, clear, and cohesive. They all start with C, so a little bit easy to remember. But the content needs balance. So you're thinking about completeness and covering the major parts of the project, the study and the analysis, but also balancing that with being concise. So it's an abstract, it often has word limits, so you don't want to contain excess words or unnecessary information. You want it to be clear, so it needs to be readable, well organized with no abbreviations. And you want to ask yourself, is this someone who is your abstract able to be understood by someone who's outside of the field? So reviewers may not have specialty in your exact area, so you want them to be able to understand what you're talking about. And then overall, you want the abstract to flow, so it needs to be cohesive. So the different types of formats that are available at conferences, they have multiple different types. In general, there's fewer slots for oral presentations at conferences, so they're often more competitive compared to poster presentations since there's more poster presentations available. And when you're submitting, there's often an option that's called poster, oral, or then there's either poster or oral, so you don't mind being considered for either one. And that's because the oral and poster presentations, they tend to have a similar content, but it's a different format. The poster presentation is similar information that would be delivered in an oral talk, but it is conveyed visually. The author is usually given a set time to speak at the conference with judges and or have conference participants who are interested visit their poster. The workshop and roundtable type format requires interaction with the audience, so the format of the abstract is often different than what we're talking about today, and it requires a little bit different planning and consideration. In writing the abstract typically includes the following sections for a program proposal. So you'll have the title, background or significance, your learning objectives, descriptions, and then your lessons learned or conclusions. Your title should be strong, and it should be clearly describe what your presentation will be about, but you also want to entice the audience. And a good way to get ideas about titles is to look at previous conference agendas and see, are the titles a little bit more playful or a little bit more marketable, or are they cut and dry and just, like one sentence about what the presentation is? So also keep in mind the conference that you're presenting at. The sections that are on this slide are typical for program abstracts. However, all conferences have different requirements, so make sure you're looking at the announcement to be sure you're following what is required. Some of them have more traditional scientific outlines, even for program proposals, and those types of abstracts include the title, background, methods, results, and conclusions, and programs can fit into those categories as well. So after the title, you're going to focus on the background or significance. You want to emphasize the story of the program, what was occurring before your intervention that required you to develop it, and what does your intervention seek to accomplish. So to frame this, you want to use existing data, so that might mean surveillance data. Think about, what did you use to gather support for the intervention or the program. You want to talk about the history behind why your agency developed the intervention or program, communicate how it's unique or innovative or different, and often, and I said this in a previous slide, but abstracts are short and they're also word limited. Sometimes the section has to be fewer than 150 words, so you really want to aim for 1 to 3 very strong sentences. And on this slide we have an example. So a weak example would be, we will present our intervention for this population that we created so that rates of HIV will decrease. So we are telling a story, but it's not a very specific story, and it wouldn't really help a reviewer know about what we wanted to present. So a strong example would be, according to CDPH data from 2015, our population of interest has been disproportionately affected by HIV, mostly due to, and then listing social determinants of health. Before the launch of our project, no intervention had been developed to address these issues. Our intervention seems to work with these populations in order to address the health outcomes of interest so that eventually the rate of HIV incidence will decrease in this community. So much stronger and not that much longer. So we're just adding some specificity. And of course, the words in bold would be tailored to your specific population. Sometimes abstracts require learning objectives. This is not always required for poster presentations, but even if it's not required, it's good to think about. So you want to know, what do you want the audience to learn? You want to avoid, when they are required and you do have to write them out, you want to avoid vague language and use actionable verbs such as explain, demonstrate, describe. We have some examples on this slide that are helpful. So a weaker learning objective is participants will learn about risk reduction and safer sex. And a stronger version of that is participants will be able to explain how to use a condom correctly in order to reduce risk of HIV transmission. So again, we're adding a little bit more specificity. What exactly will participants be able to do? Moving on to the description section of the abstract. Projects are often rich and complex, and the description requires thinking through which key points you want to discuss. This goes back to what we discussed previously about framing the abstract for a particular audience, for a theme, for the conference. And on the slide, we have an example from the Chicago Black Gay Men's Caucus abstract. This is an actual excerpt from an abstract that was submitted and accepted and presented at the LGBTQ conference in 2015. And this section of their abstract followed the background and objectives. So you want to address in the description why the intervention was developed or chosen. This example says that. How the intervention is being implemented, what went well, what would you do different if you were to do it over, and what makes the project innovative or unique. You want to really think about putting yourself in the reader, reviewers, and attendees' place, and are you sure you're describing a picture that an outsider can understand, so someone who's not familiar with your work. In the next section of the abstract, you want to think about wrapping everything up. So you want to wrap up your abstract in a concise manner, but you need to remember to summarize the key points of your abstract, discuss future steps for the current project or plans for future iterations of the project, how it might be changed or adapted, and then explain why it is important that others hear your story. So why do you want to present this information? And again, I feel like I keep saying this key point, but abstracts are pretty short, so you don't want to, this is not a very long section. You want to make it, as tight as you can and highlight these key points in about a sentence or two. And then you want to be able to tie your work back to the larger landscape of HIV prevention. So just a quick checklist before you submit. You want to know when the abstract is due and submission procedures. So try to finalize your abstract and submit the day before it's due in case of any last-minute emergencies. Maybe you're sick that day or your computer crashes, anything. So try to get it in before the absolute deadline. And then be mindful of the submission procedure. Sometimes it's just an email to a specific email address, or other times it's a web portal or other way to submit. You want to have an idea of how the proposals are being scored and how much weight is being given to each section. This information isn't always available, but check to see if it is. And if you do have that information, be sure to emphasize the sections that are being scored more heavily. You want to make sure that you stay within the character or word limit. So, do a word count to make sure, or a character count to make sure that all of the information that you want in your abstract is being included. Oftentimes, you may think that if you submit the abstract and it's a little bit longer, it'll get reviewed anyway, but oftentimes they're not accepted if they're too long, or they're not reviewed, or the system will cut you off mid-sentence, and you want to really avoid that. You also want to make sure that if it is an email submission, that your attachment type is the right type. So oftentimes there'll be a file type that's specifically allowed, whether it's a Word document or a PDF. Make sure you adhere to that. And then make sure you're attaching the right documents and not some other previous version, but your final version, and that it's in the correct format. And then if possible, the final step is you really want to have either a co-author of your presentation or abstract, or a colleague that you trust review your submission prior to sending it in, just for a little bit of extra support and review, outside review. So why are we spending so much time talking about this, and why is it so important to write a strong abstract? Well, the one thing is that a really strong abstract helps the conference reviewers quickly decide if your proposal fits the conference theme, agenda, and criteria. So you can, write the best abstract in the world, but if you submit, your HIV prevention project to the oral health conference, it's probably not going to get accepted, no matter how stellar it is, unless they have, a track on HIV prevention, which maybe they do, and you know that, and that's why you submitted it. But it also helps conference attendees decide whether or not they should attend your presentation. For those folks who have attended conferences, the way you decide what you're going to, how you're going to spend your day there, is you look at the different titles of presentations, you look up the abstracts that are printed either in the conference program or online, and then you decide which sessions to attend by that information. So once you get accepted, you're also trying to entice the audience to come and see your poster presentation.
Great. So now I'll be talking a little bit about developing a poster presentation. So assuming that you submitted your abstract and got it accepted, then now you're going to have to do some work creating a poster. So there are a lot of elements that go into designing a poster presentation. So beyond the text of the abstract, there are graphs, charts, and images to make, and then a lot of formatting that you have to do. And so you have a lot of the groundwork from writing your abstract to make a poster, but posters require a lot of time, thought, and editing, as opposed oral presentations also require the same amount of time required, but those can be edited anywhere, even on the way to the conference and right up to the last minute. But with posters, you need to make sure that you're finalized and printed before you attend the conference. And so, for example, I'm going to give some tips on a poster that I presented, and just to ensure that there are certain sections on your poster when you present. So for the first one, you're going to want to make sure that your title's at the top of the poster in bold and a bigger text, just so that's the first thing that's seen when somebody comes to look at your poster. The next thing that you're going to want to ensure is that you have your authors listed and then those affiliations. So authors in the list of who worked most on the presentation in the abstract and the poster, and then make sure to include the principal investigator or your manager or whoever's running the intervention as the last author, and then make sure everybody's organizations are listed right below that. The next thing that you're going to want to include are logos for your organization, and then potentially your funder. You have those. And then next up is that you're going to want to make sure you have all your different sections and that they're legible. So for your abstracts, you're going to be able to translate many of those sections straight into your poster. So if you have an introduction section and then you have a design section or a findings section, those are all there. And then another key point to think about is making sure you have legible text. So I am a big fan of fancy fonts, but when you're working on a poster, make sure those are standard fonts, Times New Roman, Arial, Calibri, nothing too crazy. Make sure that your text is on a darker text on a lighter background. So feel free to use color, but having a dark background with white text, for example, may look really nice on a computer when you're visualizing it, but it does come across as hard to read when it is printed. Make sure that your headings have some way that they're called to attention. So for example, my poster, I did use the darker background with the white text just so somebody's able to say, look, this is the section break, or this is a different subheading in there. And then make it easier to read. Make it easy to read. So when you're thinking about developing your poster, try to have graphs, images to break up the text, subheadings. Make it really easy for the reader's eyes to be guided from one section to the next and to know where the important information is held. And then one thing to mention is that all posters are different, and there's never a perfect poster. So for example, if I could redo my poster, it'd probably have a little less text, a couple more graphs, images, but it's always a work in progress. So it's always just good to know that it's a learning process and you'll never really have a perfect poster. And then just thinking about those tips again, do ensure that you're using those standard fonts when you're making the poster, that they're dark fonts and a light background. Once again, the light font and the dark background is really hard to read when it's printed out. A picture is worth 1,000 words, so use graphics. If you can have images about your program, if you have graphs, if you have quotes, make it less about the text that you're writing, more about what the story what the data is or what you want to present, because you're there in person to explain that data, to explain the tables and all those different images that you're using. And then if you have large amounts of text, be sure to break it up with bullets, subheadings, another way to just make it easier to consume, because remember that your participants that are coming to see your poster are going to be there for maybe 2 to 3 minutes tops. So you want to make sure that they come in, they see the 2 or 3 major points that you want to see, and then you're there to answer those questions. And then thinking about some logistics about building a conference poster. The first one is software. So most posters are made in PowerPoint utilizing a poster template. And we'll be distributing a poster template at the end of this webinar. You can also download poster templates online for different sizes if there's a different size requirement, or if you just want more space or less space. Printing costs, like Julia mentioned earlier, budget around $50 to $80 if you're printing in advance, depending on the size and the type of finish of your poster. Could get much more expensive if you're printing last minute, so really try to make sure you're printing in advance. If you're traveling with your poster, you may need to invest in a poster carrying case to ensure your poster doesn't get damaged, or you may need to print at the location that you're at. So make sure you think about those logistics when you're thinking about your poster. And then time. Between finalizing the design of the poster, getting feedback, making revisions, poster making becomes a really, really lengthy process. And so it's always, I like to say, double the amount of time that you think that you're going to need, because even then it might not be enough. So you're always going to need much more time, and it's never bad to finish early. And then don't print your poster right before the conference, like Amy mentioned, in case there's a last-minute emergency that comes up. In case anything goes wrong, just give yourself a couple days, so that way you don't get to the printer 10 minutes before your poster session, and then if your poster's printed incorrectly, you have some time to fix all of those things. And great. I'm going to turn it over to Eric Glenn, the Executive Director of the Chicago Black Gay Men's Caucus, to share his personal experience. He created and delivered a poster presentation for the first time in 2015 for the LGBTQ Health Conference in Chicago.
Thanks, Christian. Yeah, that was the first time I had ever done that. That was a lot of fun. So you all might be able to see, or rather hear by my manner, I am not of the research world or the academic world. I am executive director of a community building organization that attends to the health and wellness of Black, gay, bisexual, and same-gender men in Chicago. I did get my MSW, but I would in no way consider myself to be a full-fledged researcher, although some people would be super generous and maybe say something different. So I was really nervous before this happened, because the idea of presenting a poster to me really seemed like, oh, this is what researchers do at research conferences, or even the conferences that I've been to that were showing us, presenting programs, did seem to skew in that direction. So I had never presented before, but I did know that we had a valuable project on our hands. So his Lifestyle Mobile, the poster of which you can see right now, was really a project that went through a few iterations. I wasn't there at the very, very beginning when the first project proposal was being put through, so that added a little bit to my anxiety. But it worked out, and so here's some of the story of what happened. So before the presentation, before the poster was developed, I actually initially decided to do this because I knew the team actually presenting today, and I was like, oh, well, I trust their insight, and I like them, and I'd love to go to this conference and hang out. So I said, sure, I'll do it. And at the time, not really understanding what that process was, but trusting that it would be okay. So I got sent a few poster templates, like the one that Christian had just showed you a second ago, and I looked through them just really to absorb kind of the look and the feel, because this is something I wasn't used to. When it got time to writing the abstract, I realized something really important, that I have been talking about my project with my very close colleagues, or people who really already understood the need within the community, but I wasn't really used to talking about it to those outside of HIV prevention, outside of work with Black, gay, bisexual, and same-gender men, outside of those who worked in CBOs themselves. So it took a second to put this language together. And so the examples that Amy was showing you earlier were definitely where I started. Something along the lines of, we're doing a great app, you should just like it. And that's not too far off from being a joke. It was very difficult for me to sit down. I'm a staff of one. I was a staff of one at the time. And so carving out the space to really think, how do I drill down on this story, took a while. Luckily, when I did get down to the details, I had the support of the team at Northwestern to help refine it. The process of putting it together was really fascinating because I started to actually reconceptualize how the project came together in the first place. So really started seeing the poster presentation process as an opportunity to look back in the past, forcing my hand in some ways, to look back over the chronology of my project. So if you look, you should be able to see it in the lower right-hand corner. There are a few pictures there of the various generations of our app. And I knew this had happened. I had told people that we developed it. But as soon as I started putting the pictures down, it even hit me that there was a lifespan here that needed more description. When I jumped into the poster itself, I think the fun part about the formatting and the space constraints that Amy and Christian are talking about is that I had to say a lot in a little bit of space. There was a lot left over too, and so these were things that luckily I remembered because when I get down to my story a little bit later, there were some necessary talking points that I hadn't taken into consideration preparing ahead of time. I should also note that at this point before I printed, I was nervous about the cost because I am a small agency. And luckily there was some assistance from the team of Northwestern. Sometimes I think this happens, sometimes it doesn't, but it doesn't hurt to ask. So I got to the conference ready to present. I knew that I'd be alone and presenting by myself, and I hadn't really given a lot of thought, like what was this going to be? So like a lot of us, I didn't have a lot of time to prep, and I really didn't know what I was walking into because this really wasn't my game. This really wasn't the environment that I was used to. And I didn't actually have the opportunity to attend the conference before I went to the exhibition. So I didn't even really understand the flavor of what I was getting into. So I started thinking on my feet. Luckily, I'd been an exhibitor at health fairs, so there was some transferable stuff like a lot of us have. And I started figuring out my talking points really quickly. I'm probably not the only one on this call who's had to do this too, but it was really a different environment. I realized that there were really two audiences that I was speaking to. There were either researcher, academic types, and there were other people from CBOs who were wondering about developing their own programs. And what quickly became apparent to me, the story that I was telling really depended on who I was talking to. So when I was talking to the research academic types, they were really more interested in the development of my project. When I was talking to colleagues in CBO world, they were really interested in the implementation. But both were really interested in the lessons learned, particularly around new and emerging technology. People were like, oh, it's an app. And so there would be apps that were developed by other CBOs and apps that were developed by more kind of research bodies. And they were curious about what I had learned, and I was curious about what they had learned. What I didn't expect while trying to think on my feet was that I would get really nervous. I am a huge talker. I want to make people laugh. I like interacting with people. I love all that kind of stuff. But I did have to take a moment to breathe and to remember to take it slow, and that I wasn't alone. There were people that I knew, and that made me feel a lot better. I can imagine for people on the phone who are considering presenting for the first time that it can be a little anxiety-provoking to think I'm going into this environment I'm not used to, and I don't know exactly what to say. Well, knowing people there, if you're able to present not by yourself, that will help too. So along the way, while I was talking with people walking by, with the judges for the posters, I got some really hard questions. At first, I started using a trick that I use with my grandmother when she speaks in Spanish. I just say, really slow, and then I respond really slowly after that because I'm giving myself time. Because I can imagine, if you're like me, if it's such a different environment, it's really hard to think on your feet. So if you're able to figure out talking points ahead of time, that's great. If you're able to get your elevator speech for these two audiences, that's great too. But you're going to get questions you don't know. And so taking it slow, I'm speaking a little fast now just because of the time constraints that we have, but You'll have a little more time there, and I think usually at these conferences, like there's a little bit of wine, so people are a little relaxed. I would be judicious about if you're going to drink the wine yourself. But so when I was talking about the questions that were hard to answer, I remember there was one guy came up to me, and he had been drinking quite a bit of wine, so he was pretty aggressive. And I'm just trying to give you worst case scenario. And he said, can you speak a little bit more to your process evaluation? And I'm like, process evaluation? I'm thinking to myself, I don't really know what that means because I do my program evaluation, but I'm still learning kind of how to parse all these out to look at the different pieces, different points within my project and evaluate those. So I didn't even know what to say. And so at that point, I think I figured out, what did I end up saying? I think we're still crunching the numbers, or we're still looking at our data. We're still kind of looking back because we know that evaluation takes a while. It's retrospective. And that seemed to satisfy him, and we exchanged business cards, and that was an opportunity to follow up later. And I know there will be questions. There are going to be questions for me in the future. There are going to be questions for you that you don't know the answers to. So my recommendation to anyone listening is not to freak out, and also not to emphasize the things that you don't have, because I think that sometimes we make a good job of being conspicuous and sometimes showing off what our faults are, and this is an opportunity for you to shine. Really amazing opportunity for you to show up your program to, like we were saying before, funders, potential partners. So instead of emphasizing what you don't have, you can emphasize what you do, and one thing you do have is the ability to follow up later. And so taking that slow and moving on to the next question, because usually you'll be talking to more than one person at the same time. Afterwards, what I made sure to do was to reflect on the questions that I have been asked that I didn't know how to answer. Sometimes that can be really hard because once the conference is over, it's time to move on to the next project. But I think in this case, because I knew I'd be presenting again, and I did present again, the same poster, I was able to reflect back on those questions and be better prepared. And that's not to say I didn't get questions I didn't know how to answer, but I was much more at ease. I mean, aside from the basic kind of logistics of it all, at the end of the day, you want to know what are your talking points going to look like. And so this does depend on audience. So I'd at least try reading it out loud to a couple of people, especially like if you have roommates or spouses, someone who doesn't know your industry at all, because they'll probably say, I have no idea what this piece meant, or that was really interesting, I didn't know that existed, and that will be helpful for you. Talking with your colleagues, talking with the judges who were there at the poster presentation, you make sure that by the time it's the next conference, you would have learned something from the first, so you can grow your skills to be able to talk to people. Like I said, I was pretty nervous during the process, both of these conferences that I have presented at, but it really was a valuable opportunity to talk with others across the country that I wouldn't have had an opportunity to meet or talk to. And so making sure that you take advantage of the networking and not give in to the urge to become a wallflower, because now is really not the time. And so in terms of being memorable and professional, just being able to tell your story in a confident manner is going to be one of the most standout parts of your presentation. If you give into this whole wallflower kind of feeling, usually that reflects on your program too, and it makes it a little bit more forgettable. If you're like me and you wave your hands in the air and you talk and you move a lot, you stick in people's minds. And if you have your business cards in your pocket and you're ready to go, that's even better. And that, I think, is all I have. If there's any questions, be sure to put them in the chat box.
Thank you so much, Eric. We have the chat box ready, so for people who have questions to ask, go ahead and type them in right now. The slide that you see is a list of resources, and again, that will be given out after the webinar on a handout. So we've compiled a few things on dissemination, abstract writing, some things that we didn't talk about today, like new media from AIDS.gov, data visualization, which can be really interesting as you're putting together your graphics and visuals for your posters. And we'll go ahead and start with questions and answers. So please use the chat box. We don't have the capacity on this with everyone on here to open the phone line. Let me see as questions roll in. We have a question. So who can I contact for feedback on my abstract before I submit it? I think a couple of you touched on this a little bit, but maybe Eric or Amy, do you have anything to say about that?
So I had the privilege of talking with the team at Northwestern who was actually running the conference. I think now if I were to look for feedback, I still look for them because I am still a CDPH delegate agency. But aside from that, I would look towards my partners at other agencies. So I work with Howard Brown, and I work with AIDS Foundation, and I work with all of these agencies, and I know I have friends there that I've networked with who could spare a little bit of time at least reading over my draft.
I completely agree with you, Eric. I think that you hit the main category. So for delegate agencies that are already working with the Evaluation Center, we're happy to review abstracts and give feedback. I would say the one thing that's important is timing. So make sure that you give, the folks that you're asking for feedback enough time, and you're not panicking and sending them, like 1 a.m. emails when your abstract is due the next day at 9 a.m. or doing that infrequently. Not that I haven't done that before. Just giving folks time, but reaching out to your network, to your colleagues, to your co-authors, making sure, just because you're the primary author and you're writing the abstract, also engage other folks who are working on your project to make sure that you're accurately describing everything, and they may catch things such as like word count or technical things. So it's not always just content. Sometimes it's the technical things that fly by.
Yeah, great. We have another question. So what types of questions do poster judges typically ask? So how are you going to be reviewed on the spot? I'm going to direct this to Gregory because I know he's been a poster judge before and he's presented posters. Do you have thoughts on that?
Sure. So a lot of it depends on the audience and the poster content. Some people might be very detailed and ask you to explain what types of analyses you ran or explain your findings. Other people might just want you to give an overview of your poster, so to hear you talk about it rather than to have to stand there and read it themselves. There's a lot of different ways people can approach a poster to judge it, and I've seen a lot of different ways people have asked questions about it. I think a lot of it normally focuses on just understanding what you did, how you did it, and what the implications are from it. And if you're ready to answer those questions, then I think you should be good to go for any time you're getting questions from judges.
While we finish up the Q&A, maybe we can go to the next slide too. We have our contact information for everybody. So creating a poster sounds like a lot of work, and I don't have a lot of time. How can I simplify the process? And I do think we did sort of make it sound like it's a very time-consuming process, but that's usually only true the first time you do it. I think it gets easier and easier each time, and you'll develop your own templates. So I can maybe start with that. I think whenever you're doing anything, whether it's a talk or a poster, it's always good to start with an outline. So break your content up into bite-sized pieces, and if you have co-authors, definitely divide and conquer, so assign different pieces to different people so that one person isn't doing everything. And it's good if you share the outline together so that you agree on the outline. I think also it's important to think from the beginning about keeping your content to a size that's manageable for the poster format. I think it's easy to feel like you have so much to say, but there really is limited space. So thinking about sort of the parameters of the beginning can help you really tighten up what data you're going to look at, or which will also save you time in the long run. And I don't know if anyone else has tips on that as well.
I guess the only thing I would offer, Julia, is that if you have templates in front of you, I would lean very heavily into them. I had 3 examples. Well, not even templates, but examples. I had 3 examples in front of me when I started putting my poster presentation together, and I literally just looked exactly at what they had put, and it helped take that kind of brain burden off of me. I said, okay, I want to put my version of that answer right there. And then the rest of what directed the poster really was the information I had to offer. It started adjusting the kind of formatting of it all, but it took some of the burden away.
Well, perfect timing. We're just about out of time. I wanted to end with a thank you to all of the project staff from the Evaluation Center and our funders, CDPH, and then ask everybody to stay on the line for just a minute longer. We have an evaluation survey that we would love for you to take so we can get your feedback. We're particularly interested in topics for future webinars, so let us know what would be useful to you in the work that you do. And thank you very much for attending.